Morning.
Morning.
Morning. Right. One more minute, if everyone can just bear with us. I hope that's okay.
So that's what that does, right?
Okay. I think we'll make a start. Time's precious, isn't it? So welcome everyone. Good to see you all, and thank you so much for joining us. My name's Sally and I look after the Helpforce network. So if it's the first time you've come to one of our webinars, a special welcome, and hope you enjoy the next hour. So as you know, today's webinar, we're going to be focusing on NHS Cadets. There's an increasing focus on youth volunteering. And we know there is a lot of interest in this national programme, which is, you probably know already, is being delivered by St John Ambulance in conjunction with NHS England. And the aim of the programme is to provide opportunities for young people who may experience barriers to volunteering or to a career in healthcare. So we're really thrilled to be joined today by two presenters who are really deeply embedded in the Cadets programme and are going to give us an overview and an update on the progress. So in a minute, I'm going to hand over to our two presenters. So we've got Carolyn Bowers, and Carolyn is Regional Programme Lead with St John Ambulance. Carolyn's role is to manage and lead a team of programme delivery staff across the Midlands and Merseyside, with a focus on building stakeholder engagement and relationships with trusts. And joining Carolyn is Jim Smith. And Jim's been a great friend to our network. Jim's volunteering programme manager with NHS England. He works in the voluntary partnerships team, and he's leading on the Cadets programme for NHS England. So for the next hour, Carolyn and Jim are going to deliver their wonderful presentation. They've also arranged an interactive session after that, and there's going to be a short break in between to give people a breather. We're going to have time for questions as well. And we'd ask you to use the raise your hand button or the chat box if you prefer to do it that way, and we'll get to as many of your questions as we can. As Sam just mentioned, we're recording the session so that we can share it with you all and with anyone else who's interested after the event. And along with the slides, if that's okay with Carolyn and Jim. And without further ado, I'll hand over to our presenters. Welcome, Carolyn and Jim.
Morning. Welcome, everybody. The one other person I would like to introduce today is Jane Fox. Now, Jane Fox is NHS England Improvement, and she's the strategic lead on NHS Cadets, whereas I'm the programme lead. So Jane's very kindly. Are you there, Jane? Want to give us a wave?
I am indeed. I'm here.
Is. She's very kindly said that she'll support at the end when we're answering any questions, and also give a bit more of a strategic context at the end as well. And there'll be a few thoughts from Jane as well at the end. So we're very thankful that Jane's come along today. Now, what we're hoping is this is an interactive session as possible. You know, we would like your involvement. So we have 30 people on the call who aren't contributing today. So could you all please give me a wave or write in the comments box, hello, I'll be counting them. Let's have a, that's great to do that wave. Yep, hi everybody. Or say hello in the comments box. So it'd be great if you all do that. We've got a few claps. That's great. I think it's always good just to get us going, So we will be running a Jamboard session as well. We'd like that to take about 20 minutes. So please do contribute, and hopefully that'll stimulate some conversation there as well. And we'll be looking at the opportunities there are into the NHS Trust in terms of taking up NHS Cadets. So have we got the slide up, Sally?
Over to Sam.
There we go.
Thanks, Sam.
That's brilliant. Thank you, Sam. And next slide, please, Sam. Right, so it's important to give the national context. Now, within the people plan, see people are posting now, we talked about a renewed focus on increasing long-term volunteer opportunities in the NHS, and it actually directly referred to the NHS Cadets, providing a chance to support patients and a new route into the future in the NHS, and that we're aiming to get, by the end of 2023, 10,000 young people through the programme. It also states that we play a significant role, the NHS, to bring those furthest from employment into meaningful employment and to target our recruitment, volunteering and apprentice opportunities in the greatest areas of deprivation. And that is one of the things the NHS Cadets is aiming to do. Could we get to the next slide, please, Sam? Now, we have a number of outcomes for NHS Cadets, but our main aim here is to accelerate the spread of youth volunteering. And we are seeing that nationally at the moment. And also to increase the number of young people considering careers within health and care. And that's really responding to workforce gaps, increasing the diversity of our NHS workforce. So could we move on to the next slide, please? Great. Now, this is a true partnership. St John's Ambulance and NHS England have thrown together £6 million in total for this programme. Currently, it's a 4-year programme and it's funded until the end of March 23, with the final courses ending in December 23. We're aiming for 170 programme locations and, as I said, 10,000 cadets. And we are looking to build that continuity, to embed it further, and we'll be looking at sustainability in that last year of funding. How do we carry on this brilliant programme? So St John's Ambulance will be speaking with, and we are in conversation with them about how we mainstream sustain. And if we move on to 5, and I'm going to pass over to Carolyn here.
Morning, everybody. So this is just a little bit of how we construct sites and programme locations. So we'll partner with the local NHS trusts across the country, and we do ask them if they're interested in taking on NHS cadets, that we look at least one programme. But that's not the maximum. We've had programmes that take on 5, 6, and they increase them over the cohorts and years as well. Each programme location is basically a place where we deliver that particular programme, and we aim to have between 20 and 30 young people, depending on which programme we're delivering. And we'll let you know exactly what that programme looks like later on in the presentation. We have different locations depending on the need of the area and also where the trust operate. So we do look at our target young people, we look at the geographical areas and who we're trying to aim to get onto the programme. And that could be different depending on where we go and what we do and which trust we liaise or have in partnership with. And then we recruit experienced youth workers and volunteers to deliver that programme. And as we go through the sustainability plan into the future, it's about looking at more volunteers delivering that. Next slide, please. So how we actually construct that delivery. So sessions are at the moment a mixture of face-to-face and virtual, and of course, as you know, as we went through COVID, quite a substantial amount was all delivered virtually. We deliver 2 hours a week over around 36 weeks, and we work that flexibly over 12 months so that we can build in the needs of the young people. So for example, if they've got exams and things like that, we may take a break with those young people. They may have other barriers in their education or other parts of their, parts of their life. But that 2 hours then covers the actual delivery of the programme, but also about guest speakers and updates and things like that, because that's one of the parts of the partnership, is to bring those resources into the programme. And we also try and do that not just flexibly for the young people. We might want to take advantage of other options and other you know, other opportunities that the trust may have for those young people. And also, in order to set that approval up, or that partnership up with the trust, it may take a little time beforehand. So we'll have that discussion with the trust around their interest in getting involved, what it might look like for them, and build up to a date to start. And we have a memorandum of understanding that we get the key people to sign off on behalf of the trust to go ahead and forward that. Next slide, please. So just a bit of what that MOU actually looks like. We have or ask from the trust to get a senior buy-in, particularly around volunteering. So we might approach the volunteering team as they will operationally look after this type of programme, but also we want to get buy-in from that senior director or department. And we look at an experience or a placement, depending on which programme, and that will be a little bit more clear when we talk about the actual programme. And what we want to also ask is that these young people that come in to the trust as NHS cadets, we want them to feel a part of the trust. At the end of the day, we want them to be your future. So we always look that they would meet on site or very close to the trust and in face-to-face as possible. Now, we're very flexible at the moment around the ups and downs of you know, COVID restrictions and things like that. So we are very flexible, but we do like them to feel a part of the trust. So if they can meet there, that's really ideal for us. And of course, with that support from the volunteer manager to, you know, help with this setting up experiences, being around the trust site, getting them to understand what it is the trust can offer them, and what's there for them in the future. We also ask that we can get some key speakers. So a really important element of this programme is that the young people get some inspiration around different types of roles that could be available to them. When we look at their backgrounds and their barriers, it might be that there are only certain types of entry-level roles that they could consider to begin with. Apprenticeships, those entry-level positions. So we look at areas and bring key speakers in which could complement that. And we want to show them that an NHS isn't just not about clinical, it's about a bigger family of NHS roles. So they can do anything from administration and IT and, you know, things that don't require to go down a clinical route or practice. So we want to try and provide them with a wider perspective. And another part of that also that we ask, that we might want to look at the needs of the trust as well. So we've had some trusts, for example, will say they've got an ageing estates department, for example, and they want to encourage more young people to consider careers in estates. And then we can look at that and how we can bring guest speakers in for that as well. And then, of course, take on the NHS cadets for volunteering experiences or roles, depending on the age of the programme. Next slide, please. So this is just a bit more in depth about who we're targeting. So as part of this project, we really want to target those that do have those barriers to considering healthcare futures. These are not, it's not an exhausted list. We do look beyond this, but these are the ones that are most common when young people have applied to come on board to NHS Cadets. You know, things like they have learning difficulties or disabilities, and we've just embarked on 4 SEND scores across Merseyside to try and reduce those barriers of those young people accessing healthcare. You know, we've definitely got a huge amount of young people who are young carers, and we've got good statistics to show that, and it's one thing that we are really proud to be able to promote, and also other elements like young people at risk of need, those that are from the LGBTQI plus community, you know, those from British ethnic minority and things like that. So like I said, it's not an exhausted list, and we do look at other elements as well. So young people can come to us and say, I've had this barrier, this is what's stopping me considering, you know, this kind of pathway, you know, could you help us? Yes, we can. Next slide, please. So as I mentioned earlier, this is a bit more about how we construct the programme, what's on offer for young people. So we have the foundation and advanced pathways. The foundation is our 14 to 16-year-olds, and then we go on to our advanced programme, which is 16 to 18. We have a little bit of a crossover of ages because we want to ensure that if a 16-year-old young person isn't ready for an advanced route, they can still start with the foundation pathway. They might want to build their confidence first, might want to start with an introduction into it, and then consider going on to advanced later on. As I said earlier, it is a 12-month, well, I'd say 12 months, it's 11, 12 months depending on how things fall, but there is around 36 to 42 sessions. We've got a few more that includes their first aid. In terms of the first aid, we actually consider and run a bit very similar to the Key Stage 4 schools package that we have on offer. So it's very much tailored to exactly what they might need in the workplace, and giving them the basic skills. We don't ask them to use their skills in their volunteering or anything like that, unless the trust would like them to. It's just something we want to ensure that the young people have that basic knowledge as somebody coming into the workplace. And then I'll come back to the volunteering experience or opportunities, but just at the bottom there, it's just some of the topics that we cover as part of the programme. We have basically broken down what we feel is going to be really useful for them coming into a healthcare environment. And then obviously we translate them into making sure that they're prepared for that. Particularly at the advanced level, we look very much more in depth around, you know, the systems and care needs and principles, direct patient communication, and then looking at career skills and what might happen next for them. Very large element it is as they get towards the end of particularly the advanced pathway, we want to make sure that they're going to have something that they're going to go on to, whether it's continuing their volunteering or they might look at apprenticeships, internships and things like that. So just popping back to the volunteering experience, this is obviously quite a large element of why we're doing this programme. It's really important and can be seen as a barrier in other places across the country, that volunteering in healthcare can be quite challenging for setting up for young people. a lot of trusts, they do it amazingly already, you know, it's their bread and butter, they've got work experience on, and we will take complete advantage of that for these young people. They might already have programs running and things like that. And then they might have smaller, particularly if the trust is smaller. We've got a few mental health trusts that are on board that don't have these opportunities but would like them for young people. So we're there to help facilitate that. So at the foundation pathway, we're not actually looking for them to become a trust volunteer. What we're looking for is an experience. That could be a group experience. We might bring them to the trust, show them around. You might want to kind of talk to them about what the trust values are, what you're trying to achieve there, some of the departments that they might be interested in doing in the future. So to complement that, guest speakers really of different departments and areas of the trust. So that experience is flexible, it looks different in every trust. We would work with you to find out what that might look like for the young people. At the advanced pathway level, this looks like what we were trying to achieve is bringing young people in as a trust volunteer. So we want them to follow your processes, whatever that might look like. They might need to apply, to have an interview. They will do their go through the system references, DBS, whatever that trust requires of a trust volunteer. We support our young people to do that. Of course, they, as part of the signed process of this, they're technically successful, but we still want to show them what it's actually really like to apply for a volunteering role and give them some practice and show them in reality what they're expected to do. And that includes training and things like that. So as we get into the programme, they start off with induction, they do a key skills session. So we cover things like confidentiality with the young people. We cover things like safeguarding, moving and handling. So all those basic things that you would require to your volunteers, we do that with them. But they're equally, you know, if you've got trust training policies you cover and things like that, we try and complement that as well. Next slide, please. So just a quick overview of safeguarding. What we try and do is we kind of review and regularly look at you know, our policies and safeguarding. We've just had some updates recently that we're looking to improve what we do. We always ensure that our staff are delivered, that are trained to deliver the programme. They've all equally done their safeguarding training. We always have a minimum of 2 adults to be there to deliver the programme. They're all DBS checked. They go through a very rigorous system, exactly pretty much what you require your staff to do. And then, you know, we ensure that you know, everybody is safe, the young people and the staff themselves. So that's just a quick kind of overview of our safeguarding. Next slide, please. And I think I'm handing over to you, Jim. And you're on mute.
Thank you for that, Carolyn. It's important to think about what the benefits of this programme have been, or could be. So we've got 5 key benefits that we're finding. For young people, social emotional wellbeing, new skills, volunteering experience going down well, we're going to be increasing that. Accredited learning portfolios and improved career prospects. And we've been hearing some comments from young people about the programme and little film as well later in the session. Service users, we know improve satisfaction, lowers their isolation, there's improved healthy behaviours. And for staff, we know it frees up time and there's improved satisfaction there. We know young people can bring a real energy to the service. The services adds patient experience and provides a different perspective, gives culture change. The communities, it helps us link those communities. and it diversifies the workforce, and it engages young people in the community and in health. So next slide, please. So to give you a little bit of an update, we currently have 115 programs running, 66 foundation and 47 advanced. Now we've had 3 graduation events have been held with guest appearances from Chief Nurse Ruth May and celebrity guests. But one of the real highlights for me in terms of the most recent graduation event was the attendance of a young carer who's also an NHS Cadets. Now, she had never presented nationally before, obviously, and we asked her to do the Midlands Safeguarding Conference on the Friday, and then also the graduation event with Ruth May on the Saturday, and she was superb. You could see her confidence grow just even between the Safeguarding Conference and then the graduation. You know, she's speaking so fluidly and passionately about what that experience has been for her. And you know, hearing that from young people about what it's meant for them in terms of building their confidence, what it's meant for them in terms of increasing their ambitions, has certainly been a highlight for me and I think many others this year. Most programs now we're returning those to face-to-face delivery, which we're thrilled about. You know, I think it has been quite challenging for young people to run that virtually in some cases, although some young people have found that actually really a little bit more accessible. So we are looking at how that could work in the future, and we are looking at getting more volunteering opportunities started in trusts. So next slide, please. And where we are now, we have over 1,700 NHS Cadets to date, which is outstanding. And you know, I have to massive thanks to our St John's colleagues and all locations that have picked the programme up. You know, under COVID, to get that many young people on the programme and keep that running during the midst of COVID was just outstanding. We have over 1,000 on the foundation programme, and we have currently 729 in the advanced programme. And we have really strong diversity levels across all programmes, and I'll touch upon that in the future. We're also looking to accelerate our targeted work over this next year, looking at, you know, all those characteristics, how we can make the programme most accessible, and that they really want to get on that programme. It's something they want to aim for, and it's easy for them to do so. So we're looking at that, making sure the programme's accessible for all this year, even more accessible for all. So next slide, please. Right, so here we are on the characteristics slide. Now you can see 79% of our cadets have at least one characteristic. Now we actually anticipate that to be higher because we have an opt-out box. So those people that opted out aren't actually in these statistics. And we can see the little sort of sliding graph on the right-hand side. And you can see that we've got percentages here that consider cadets with at least 2 indicators. So you can see one of those to pick out a highlight. Young carers, also ethnic minority, that's 10.6%. That's high. You know, we're doing really, really well in terms of making sure it's accessible to a diverse group of young people. If we could move on to the next slide, please. I really like this slide. It's a great representation of where we are. One of our aims this year might well be to look at those gaps, start expanding our range across the country. So if you see your trust is in some of those gap areas, really think about how you become a champion in that area and pick this programme up and start reaching out to community young people in your area, and responding to some of the workforce issues, both nationally and in your locality. So just looking at that now, you can see there's a bit of a central spine going down from Birmingham to the south coast. We've got that area, we've got that area there that we're going to be reaching for, right down to the southwest. But we're hoping for some good news on that soon. We can see East Anglia. We've got a little bit of a gap as well. So as I say, if you are in any of those gap areas, please drop Carolyn a line. drop her an email. So if we could go to the next slide, please. Right. So just talking about some of the participant experience NHS Cadets. So this was a young person that was on the foundation for 14 to 16, and they wanted to get involved with volunteering opportunities. So this person said they were interested in a career in healthcare and paramedic science. So that's why the course appealed to them. They say that they've enjoyed communicating with others and they've enjoyed working in a team. And it's really helped build up my confidence, their confidence. And we discussed that earlier on. And then this is one of the important ones. They said it's given them more information about a potential future in healthcare. But again, confidence has come through, the confidence to do that, the confidence to go for a role in healthcare. Next slide, please. Now, this is from an NHS Cadet who identifies as coming from a British ethnic minority. This person saw NHS Cadets as a great opportunity to explore a career in healthcare and to meet new people. And I think meeting new people under COVID, it's been virtual, has been really, really important for young people. They've enjoyed learning the skills needed to work in a clinical setting and how best to communicate with patients. It says they've made them more understanding and observant of things they haven't noticed before, such as patient privacy and pronouns. And it showed that if they work hard, they believe they can achieve whatever they want. And that seeing people from a variety of backgrounds from the programme, it inspires them. There's some quite strong thoughts there from young people in terms of how important the programme's been to them, what it's meant to them, how it's helped them develop their confidence. So we're hoping now we can hear directly from a NHS Cadet from Croydon. Might need to go back to the beginning there.
Hi, my name is Linley, I'm 16 years old and I'm part of the NHS Cadet programme. Today we looked at so many different cool things. We looked at CPR, the different equipment used to resuscitate people, and other cool life-saving aspects of healthcare.
It's uncomfortable, isn't it?
We got some hands-on experience we worked with Annie, which is the dummy used for CPR. That was really fun. We actually got to talk to some health professionals, which is something that you don't normally get. So we got to talk to different people and we actually got to touch and have a play with the equipment as well, which was a really unique experience. When I'm older, I would really love to become a doctor and work with the NHS. I knew that this was the perfect opportunity to get experience in a really fun, interesting way.
Thank you very much for getting that to run for us. Always fantastic to hear from the young people. Always great in my role where I actually get to speak to them in preparation for doing things like presenting. And as I said, just seeing that jump in confidence when I talk to them to when they present beautifully and talk very passionately about what they do. So that was great. Now, what we're going to do now is we're going to have a 5-minute comfort break.
Jim,
Yeah.
can I just jump in, please? Because I think
Jane.
there's a few things that I'd like to pick up that have sort of come up in the presentation that I think will be really useful to talk about before we go into a break. So I'm Jane Fox. I'm the sort of senior lead for NHS Cadets within NHS England, and obviously work really closely with Jim and the wonderful team at St John Ambulance to help sort of take forward the programme and develop it. One of the things that I'm sort of keen to help people understand is that this programme was set up just before the pandemic hit, and the programme was set up to be a 3 to 4 year programme, with the intention being that there'd be around a year of developing the programme and testing it in a few small in a small way with a few sites. That would then inform a rollout and enable that ongoing learning, evolution and development, and then moving on into actually continuing to run that programme and moving it into an ongoing fuller rollout once we'd applied that learning. I think COVID threw everybody a curveball, as we all know, but we really battled on, I think is the best way to describe it, with cadets, because we were so close to getting things going that we decided to press ahead, keep cadets going through the pandemic. But obviously that had some impact on the way that was being delivered. As Jim and Carolyn have said, it had to go to a virtual environment, so a lot of it was delivered online. So I think it's fair to say that some of that learning we're still doing. We're still looking at the programme, looking at how it best works, and still in that rolling out and continuing to develop it phase. So we're really keen to hear from people who want to get involved, might be thinking about this for something in the future, might want to look at what's the experience so far. And I think it's really key to say that the programme, when we talk about it sort of ending in September 23, that's just the current cohorts that we've got going through. Cadets will be continuing. The whole idea about this programme was to get it up and running and to kickstart and get it in place. What we want to do then is look at that sustainable model and keeping it rolling forward, working really closely with St John. So please don't worry if anybody heard the word ending. It's not ending, it is continuing very much. What it means is this current phase of build and development will be coming to a conclusion that enables it then to continue rolling. But I to be honest, I don't think it'll ever stop evolving or ever stop learning, because as we are rolling this out with more and more trusts, we're looking at how it fits within the local community context. We're looking at that evolution beyond the trust sort of boundaries, as it were, out with working with communities and others. The really, really positive thing about cadets is that it is a youth programme, but it's not just about getting young people involved. It's actually about that whole inclusion agenda. It's about looking at those marginalised or disadvantaged communities and really putting something in place that supports young people who wouldn't normally step forward and put themselves forward for these types of opportunities. So we work really closely. St John's Ambulance have got a whole team within each of the regions that work really closely with the trusts to understand those communities, the community needs, etc., that really make a difference to you and your organisation. How do we reach out into those communities that we know there are lots of young people who may be disadvantaged? How do we bring them into the NHS family through that opportunity and exposure to volunteering, and beyond that potential for future careers, study, employment? And the really, really positive thing about the programme that's been put together, so it's a fairly standard kind of programme. There is flexibility to be responsive to local community needs. So for example, if there are things that are a particular sort of health issue within that population, it might be that the course kind of tailors itself a little bit to address, might be healthy eating in a particular community, or it might be a prevalence of some particular illness that actually spotting the warning signs is really good. Spotting the warning signs for diabetes, what people could do to address the diet, all that sort of thing. That learning is going right back into those communities and improving the health of those communities through those young people, but also helping them to help themselves in terms of knowing what to do, where to go, etc. It is a partnership. It's a partnership between NHS England and St John's, but even more than that, it's a partnership between St John's and the trusts. It's about bringing together those players and understanding what's needed, and sort of facilitating and enabling your young people within your communities to really get opportunities through the programme, as I say, to experience volunteering and to hopefully become some of the volunteers of the future, and potentially through that exposure look at helping them on that potential career path. I wanted to just update on some of those numbers because I got some bang up to date numbers the other week from St John's, and we've currently got about 2,700 young people who have been registered for the programme, and we've got another 700 in progress. So we are making real inroads in terms of reaching those young people. We've got the programme running in 109 locations, and that's working with currently 61 trusts. So you'll have seen there's quite a good coverage across England, but we know there are some gaps. And as Jim said, there's a real aspiration to keep expanding the programme, but actually looking at where those gaps are, where the needs are greatest, to try and help people to address those needs within their local communities. The other thing I did want to just mention, sorry, I've made notes here of all the things I wanted to say so I didn't forget, is that I know there's a couple of people who've said they'd be interested in talking to others. So we're just in the process of setting up a futures platform for NHS Cadets. And one of the things that we will be doing through that platform is it's not only for those that are already signed up, but it will be for those that are interested, are already having discussions, are thinking about signing up, etc. So we'd really like to sort of enable those conversations, enable you to do that peer-to-peer support, to share that understanding, that learning, and you know, as we are a learning programme. There is no right or wrong answers with some of this, so we haven't necessarily got it all right. So what we want to do is make sure that through the programme we are learning more and more about how we can develop it to meet the needs of these young people, but also fit within the context of the NHS and your local organisation's needs. And I think there was one other thing which I cannot think of here. It will come back to me while we have a break, probably.
It's really helpful, Jane, and I'm sure that I come back to you by the time we get questions. Now, we have only got about a quarter of an hour left. So are people comfortable if we carry on without the comfort break? Please, if you absolutely desperately need one, please run and take a little break. But I think it'd be great if we actually had a bit of time to sort of talk through some of the Jamboard sessions. And what was brilliant is I'm seeing in the chat box that organisations said, oh, we want to speak to somebody about how NHS Cadets is working for them. And I think it's great. It shows the benefit of the Helpforce network, that people are saying, yes, come and speak to me, I'm running it, it's great, you know. So it's lovely to see that community sort of chatting to each other and supporting each other. So I think that's real credit to Helpforce and you guys. Now, what I'm going to do now is I'm going to post a Jamboard session. You just click on the link. We'll be talking about the benefits and opportunities for NHS in your trust. Now, if we have any technical problems with that Jamboard, please put in the comments box in Teams. We'll pick up on that. We'll all come out of Jamboard and we'll have the conversation in Teams. So hopefully now you can all get into that Jamboard session.
How long do you want us to have, Jim?
We'll have about 10 minutes.
Okey-doke.
Maybe a little bit less because we're running a little bit tight on time.
Yeah, okay.
So how are we doing? Are people in that Jamboard session? No? Okay, you struggling?
Okay.
No problem. If other people aren't, let's just come straight back out and ask the questions. So I'm going to ask you this question now. And I shall pop it in the comments box. I think we'll just do the benefits and opportunities based on time. So what do you see as the benefits of the NHS programme to your organisation? First question. Second, and the community it serves. So I think we've got a few people on the programme now, and I've seen you've been quite vocal. So what please post in the comments box or put your hand up if you'd like to speak. Milo. For those people that have got the programme now, let's ask you what you see as the benefits. Who's got the programme now? Could you put your hand up, please? I can see Gillian's got a hand up. Would you like to speak, Gillian, or is that a legacy hand?
No, it's not. It's not a legacy hand. I mean, I see some really clear benefits for trusts to increase their reach to their local communities, targeting young people, particularly in areas of high deprivation. And I'm really interested to better understand how, which is a fantastic opportunity route, but how does the programme support trust voluntary services to increase capacity and resources within their services to enable this kind of engagement with the programme?
So if I can jump in there, this is a programme so that the support comes from the St John Ambulance. They are the organisation that will coordinate and staff and run the programme, but that has to be in partnership with the trust. It has to be around supporting and understanding the needs of the trust and the local community and bringing that local intelligence to the discussions. But it is a bit of a quid pro quo. So obviously it's about that longer term opportunity, the benefits it can bring to the trust in terms of that potential route for volunteers, the additional support that volunteering can bring, and that potential route through into workforce. And I did remember what the additional thing was I wanted to mention to you all, which is obviously we're talking to you today as volunteer service managers because of that inextricable link and benefit and opportunity for workforce. There is something around how we make sure that within the NHS trusts, the organisations we're working with, that we look at that whole benefit to the organisation, and it's not just about engaging with the VSMs. We can do it just with the VSMs. If a VSM wants to run the programme, that's fine. But actually, there's real benefit in bringing colleagues and senior partners and sort of thinking about the workforce and how this fits in that wider context as well. But yeah, it's really the programme itself is about looking at building on what is already there within the volunteer services and actually finding that route for inclusion of young people and specifically those from disadvantaged backgrounds.
Thank you.
Okay. And thank you for the question, Gillian. And I can see Amani has got his hand up. Is that a legacy or his or her hand? Is that a legacy hand or a? So you're putting it down, Amani. But if you do want to come in, please do so now. And if not, that's no problem. I'll just check. We've got okay. So I'm going to post the next question now. What do you see as the long-term potential for NHS Cadets in your organisation? How do you think the programme's going to benefit your organisation long-term? And I'll just check if we've got any hands up or anything. Anybody want to comment on that, please, in the comments box? Okay. Check hands. No, we haven't got any hands. Jane, did you want to come in and say anything about a long-term potential?
So I was really worried then that I'd stolen your thunder by actually starting to answer that question in terms of
No.
that benefits into the trust itself. I think volunteering, we all know the benefits of volunteering, both to individuals and to the organisation. The great things that it brings in terms of benefits to the staff, benefits to the services, certainly benefits to the patients, but also those benefits that it brings to the volunteer. I think the added value with this is these are young people. I'm going to say this in a very colloquial way, but if you get them early, young people often volunteer for life. So there is something around building that that relationship with the young people within your communities that potentially will be those volunteers of the future, but also potentially the workforce of the future, because how many people from an experience in volunteering think that this might be something they'd like to do as a longer term career option, or go on to do education studies in health related fields. So it's really about that pipeline of young people where we can make such a difference. And I think the other biggie for me is think about what these young people are taking back into your communities, that awareness of better health, that awareness of services, how to access them appropriately, how to support their families and friends and peers to, you know, understand and know how to look after themselves and the people in the community. So there are some real, I think, long-term benefits from this. But it is hard work. It's not easy. It's not a straightforward thing. And there was one other question that's popped up in the messages, which is, if I interview the young person and they're not right for a role, what do I do? Actually, there's something around thinking differently. So our idea with these young people is not to slot them into existing roles, but actually to look within that volunteer experience for the younger ones. How do we help them to understand the types of roles, the types of things they might do, but understand things about, you know, what volunteering means, what social action means. So it might be that they're not appropriate to come into your environment immediately or directly, but actually there are things they could still do where it's volunteering and giving back in some way. So it's thinking quite creatively about that and working with St John's and others to look at how we really give everyone that opportunity. But when we're looking at the volunteer experience for the older age range in the advanced programme, it might be about actually, is there a tailored version of a role? Because actually we wouldn't expect them to go into one of your roles as part of their sort of volunteering program. What we want to do is feed them into that potentially during or beyond the program. But to begin with, it might be about giving them shadowing opportunities to sit alongside another volunteer, or thinking about tailored roles that would work for those young people. And some of these people, there might be challenges, there might be things we need to really think about. Again, working with St John's to work through some of those, think about what opportunities, and it might be the trust environment is not the right place for those young people. Again, looking at how do we work with our partners in the community, how do we look at different opportunities. So it's about that flexibility, and I think thinking about, are they, you know, am I looking for somebody with X, Y, and Z skills, knowledge and experience? No, we're looking at what can this person bring and how could we give them a flavour that makes them someone that for the future is part of our healthcare family and can either volunteer with us or potentially look at going on into further study, education, healthcare, careers, etc.
Really helpful. And as you've been speaking, we've had a flurry of people talking about the long-term potential. Alison, Gillian, Jane, all been throwing thoughts, and I can't see further down the comments box. But we talked about growing the workforce, improving population health outcomes by sharing key messages. We've talked about the potential for people to stay in employment or in the apprenticeship scheme. We've talked about health inequalities, and a really good one here about senior buy-in within trust, better understanding of the benefits of having young volunteers. Thought that was a great one, Gillian. So if we go back to the slide deck now, we've got about 4 minutes to go, and hopefully we'll get down at least until the questions. Now, if we don't get to the questions, if that would be okay, Sally, if they could send any questions to you guys, and perhaps you could send us back a little package if we don't get to them, and then we'll do our best to respond within a week or so.
Yeah, sure,
So,
that's absolutely fine, Jim.
Thank you, Sally. So our ask from you, to understand this is not a funded programme. It's resourced by St John's Ambulance Time in the locality. Continue to think about what the benefits would be to your organisation. Encourage your trust to sign up. Discuss any concerns and ideas about being ready to work with volunteers or staff who bring them additional needs. Share case studies with us. Those are fantastic to share with us. It really gives us a stronger base to talk about the wonderful things that are going on in youth volunteering and the benefits. Next slide, please. So, for further information, there's the NHS Cadets website, and we'll be sending a PDF of the presentation out afterwards. To register interest, there's an email there for you to register interest. And I believe we've got the regional leads in your areas. Next slide, please, Sam. And here are your regional leads. So if you're in these areas, say, for example, Carolyn's in the Midlands, please feel free to go to Carolyn direct to start those conversations. Now, as I say, we have round about 3 minutes for questions. So perhaps we can take one question in the next 3 minutes, then we should finish at 12 sharpish. If you've got any more questions, as I say, please feed them through to Helpforce and they'll feed them through to us. So if anybody else, or can we see in the comments box any questions that we'd like to pick up on? So please put your hand up or pop it in the comments box now. Okie doke. Well,
Is
if you
that
haven't got,
Imani?
Sorry.
You've got your hand out. Is that
do you
is that a
want
new
to-
hand, Imani?
I think that might be legacy.
Yeah.
Okay, well, no problem. I mean, there's been a lot suggested, and I understand that, you know, some of the questions might come up into your mind over the next day or so as these things go. So, yeah, please feed those through to Sally and her team.
So Imani just popped into the chat
Oh, yeah.
a message. It was, when can I sign up to do the experience?
You can contact your St John's Ambulance regional lead in the next 2 minutes.
I've
No.
just suggested we can share the St John lead, so Caroline can probably provide those contacts if anybody would like to follow up directly.
I can put those in the comments box now, hopefully, if the cut and paste
And
works.
Are we okay to share the slides, Jim and Caroline, with the group?
Yes, I can PDF those and send them to you straight after the
Great.
presentation, if that's all right, Sally.
Yeah, thank you.
Wonderful. Well, first of all, a huge thank you to those of you that turned up today. It's been fantastic attendance. I've not seen anybody drop out, so that's brilliant. So thank you very much for staying with us throughout the course of the presentation. Thank you to Sally and the Helpforce team for inviting us here today. Thank you to Jane, who come in last minute and been there to answer some of those more difficult questions. Thank you, Jane, and give us a strategic perspective. And thank you to Carolyn as well for supporting in the presentation today. So I hope you all have a wonderful day. We finished dead on 12, which I find very satisfying. Thank you and goodbye.
Thank you all.
Thank you
Bye-bye.
all. Bye for now.
Thank you.